Hi everyone, I'm here with Dr. Steve Bierman at the end of this very nice training, 3-day training of medical hypnosis. And I'm going to ask him a few questions that I think will be very helpful for everyone because some of the topics that we discussed here are of concern for everyone who might come into a situation where some of the stuff might be useful for you, for your family, or maybe for your friends. So, Steve, the first question, you were talking a lot about curses and doctors giving curses. So maybe you could give an example. What do you mean by curses that doctors are giving to people?
Yeah, I'm happy to do that. First, let me say, I understand most doctors and healthcare professionals are very compassionate people. And we know that part of their training does not include what we spent time on today. Unfortunately. So most of these curses are inadvertent. They're not intentional. But I'll give you some classic examples. The worst curses, of course, when a doctor says, you have so much time to live, right? How much time do I have? You have 6 months. That doctor, you have to understand, he doesn't know his own tomorrow. And yet he's predicting someone else's tomorrow based on some very narrow information, very narrow experience. And so that's a curse. And why is it a curse? Because they don't realize it, but by virtue of their authority, their words actually produce responses. And we see that all the time. That's what placebo is, right? A positive response, we call that placebo effect. But a negative response happens just as often. And that we call a nocebo effect. If a doctor says, you have a viral syndrome, there's nothing I can do. Go home and tough it out. You should be well in 5 to 7 days. That's a curse. He could just as easily have said, it appears you have a viral syndrome. Some people take longer than others. Sometimes it takes 5 days. Others, perhaps, opposite, just like you, discover yourself get well in a day or two. Why don't you call me tomorrow and let me know how well you feel?
That will have a different effect.
A different effect. You know? Why curse when you can offer an honest but positive suggestion?
Good. And so, what can I do to prevent the curse? Let's say, maybe one day, let's hope not, I might be in a situation where I'm confronted with the doctor with a diagnosis or something. So how can I what can I do to protect myself from being cursed?
Right. So remember, curses only work if you assign authority to that person. So of course, first, be careful who you select as your physician. If you have a doctor and you don't like the way they talk, you don't like how negative they are, that's not your doctor. Get another doctor. You have agency. You have sovereignty. If by accident something comes at you and you recognize it, inside, refute that immediately.
What was the refutation of that?
I had a patient whose doctor said, when you break through this treatment, meaning when the treatment stops working, when you break through this treatment, we may have another one for you. And my patient immediately said, you mean if I break through? And he lived to be 94 years old, and he never broke through. In other words, govern yourself, retain your sovereignty, use all your healthcare people as advisors, as consultants, who you can either keep or discharge, depending on how you feel. You're not stuck with any one doctor.
So I should challenge also the doctor? Should I do, let's say the doctor says something very nasty, like a very bad curse. Should I just do it internally, or should I also
Right.
challenge it.
So the most important thing is, of course, do it internally, right? Excuse me, you may think to yourself, this guy's an idiot. He doesn't know me, because of course he doesn't know you. No doctor knows you and what your fate will be. You have to understand that. They know statistical information and narrow experience. They don't know you. So yes, affirm that internally. And then it's your decision, it's your personality, it's the circumstances to decide whether externally you want to vocalize that. You don't have to go back to that person.
That's true. So, let's say I have a family member, a friend who got a bad diagnosis. Maybe they were cursed and maybe they're in shock, maybe they're depressed, maybe they lost hope. What can I do to support this person? What can I do to maybe increase the chance of recovery, of healing, of survival?
Right. Well, you just learned hypnotic technique in this last 3 days.
I mean, for the people who are watching, who haven't gone to the training, what can they do?
So the best thing to do, if let's say the family member received an unfortunate curse, you have 6 months to live. First you need to know, what does the patient want, right? Does the patient want to be healthy? And so you can just ask them. You know, it's very important that you have aligned intention. That what you're trying to do for that person is in fact what that person wants. Well, let's say in this case that they said, yeah, you bet, I'd like to be healthy. I don't want to do what that doctor did. Well, then you begin chipping away, because he is an authority and you're not. And so you do the best you can. You think that doctor is 100% correct in every prediction he has for his entire career? Because I'll tell you one thing I know. I know that when doctors have told me something, I'm pretending I'm you talking. When doctors have told me something negative, maybe that happens for some people, but that doesn't happen to me. I'm pointing to that person. There are always exceptions, and you've always been exceptional in my life. And then, if nothing else, then you tell a story, you know, about somebody. The theme has to be, the doctor was wrong, and the patient went on to live happily ever after. And if possible, tell a true story that you're aware of. And if not, come as close to that as you can.
And I mean, it's the fact that also what you told us from your case studies and just what everyone knows, there are spontaneous healings, spontaneous remissions of people who are like
all the time.
You know, like they have a very like late stage cancer or whatever disease, and it happens. And doctors are like, they cannot explain it.
It happens all the time. I have dozens of cases like that. In fact, I love this quote, near quote from Dr. Bernie Siegel. Dr. Siegel wrote a beautiful book entitled Love, Medicine, and Miracles. And in it he said, there is no disease, no matter how severe, that at least someone hasn't survived, even from the threshold of death. And when I first read that, I thought, no, that can't be true. But as experience has taught me, and I'm sure it's teaching you, it's more than true. It's actually common. Miracles happen every day. Wonderful events, surprises happen every day. No doctor you know has ever taken a proper course on prophecy, because it's impossible. Every individual is different.
Yeah. I really like the quote because it's something that you can also bring up. You can tell people about this Dr.
Right.
Bernie Siegel who said that,
Yeah.
and
Yeah.
use this, right?
Sure.
So let's say someone has an operation coming up, or they're getting an injection. What's the best way for how they can prepare themselves for that operational injection? Like, if they don't have access to a hypnotherapist,
Right.
they can kind of guide them through it.
So
What
let's
can they do
think
for
those
themselves?
separately, okay? I had a friend call me up. He lives in Massachusetts. He said, Steve, I can't come and see you. There's no hypnotherapist here who does your pre-surgical hypnosis technique. What do I do? I said, Rich, there's a moment before surgery when the anesthesiologist will give you a pre-surgical sedative. And that's a precious moment. Ask him to push that drug very, very slowly. Say you want to stay awake for at least 10 or 15 seconds before you go out. You don't want to waste time counting backwards. That's silly. And as he starts, tell him, be sure, go slow. You say to yourself what I would say to you in trance, right? Keep my own blood, every drop. Keep my own blood, every drop. A dry field, dry surgical field. Wake with delightfully surprising comfort. The drug is infusing. You're beginning to fade. Delightfully surprising comfort. And experience really rapid wound healing, really rapid wound healing, really rapid wound healing.
Right.
In essence, the drug is inducing a deep hypnotic trance. And you're using self-hypnosis to drive those three very important ideas in. And he had his labyrinth removed for a vertigo problem. Woke up. There had been no bleeding in surgery. He woke up perfectly comfortable. No dizziness or vertigo whatsoever. And he was healed up in 3 or 4 days. Yeah. I said, wow, Rich, I didn't know you were that good.
Right. I mean, everyone can use the skills by themselves.
Yeah.
So
In terms of a shot, it's even more so, right? So if I'm giving someone an injection, I have to get their attention, and then I have to direct it away from feeling. And there are ways to do that. But you do that yourself. You have control over where your attention goes, right? If I'm about to give a little child a shot here, I said, I need you to look down there, okay? And make sure nobody comes through that door. Now they're not looking at the shot, okay? There's going to be a very weird sound, a very peculiar sound. And I need you to listen. Just listen. And while they're fully absorbed in listening, I give the shot. Half the time they'll say to me, you're right, that was a strange crunch. Where did that come from? Right? So for yourself, you understand you need to be focused in a different modality. Okay?
a different sense.
A different sense. Right? It can be visual. It can be auditory. It can be cognitive. Right? You can give yourself a math problem starting right now.
All right.
The needle's coming. And what I want to know is what happens when you multiply 4 times 4 6 times, starting now, or 2 times 2. And just run that math problem while things are going on. You're completely absorbed cognitively, and you're not in the feeling mode. You can do the same with anything. You can look over at that clock and count the seconds and say, how many seconds until the next time I swallow, or until my second swallow? And be completely focused on counting time. But it's a simple idea. Put all your attention in a different sensory modality.
Yeah. So away from the feeling,
Right.
to visual, what you're seeing, or what you're hearing, or cognitive, like with the math problem, or anything like that.
Perfect.
How can I use the placebo effect to my own advantage if I have to take a pill or medicine? Because, like you said to us, like in every treatment, there's a certain percentage of placebo effect anyway. But how can I increase it for myself if I have to take a medicine or something?
So you're taking, let's say, some antibiotic. How can you get a stronger effect? So what you're asking is, how can I use my mind to help along with this antibiotic? And if you were hypnotizing someone, meaning if you were putting someone in a trance and offering ideas, what idea would you offer that person? Some sort of healing suggestion.
Sure.
Right? You're no different. You're no different. And so as I take this, I need to realize I'm not just taking the antibiotic. I'm swallowing all the helpful influences of the world. Right? I'm delivering all the helpful powers I can. And inside, they're meeting with the forces of my own healing system and multiplying. And you create some visual imagery.
Oh, okay. So
Right.
like maybe have a visual, like for the medicine, like some, I don't know, maybe some soldiers or some kind of force like moving through the body. And
Whatever image occurs to you is going to be the right image for you. Just like your dreams, exactly the same, right? Your unconscious will provide the image. All you have to do is watch it and develop it. You know, for me, I take that as a seed,
Oh,
right?
okay.
That seed blossoms into this beautiful
Oh,
tree.
that's beautiful.
The beautiful tree flowers. The flowers attract other aspects of nature. And before I know it, it's just the full blossom of nature itself. Wellness. You pick your soldiers, I'll pick my trees.
All right. One last question. Let's say I'm witnessing an accident or someone has an accident and they're like, there's like an emergency situation, maybe the person's in shock or something, like, and maybe I do first aid. What are some things that I could say to that person that will, because a lot of times what happens also, I have some friends who are doctors that tell me, well, that maybe there's accidents with bystanders and people are saying, now they're helping, but they're saying, oh, this person, you will never walk again, or he's losing so much blood. So, this, and even if the person is unconscious, it will still maybe have an effect on the person. So what are some things I could tell?
Well, here's the most important thing to realize. Whenever anyone is helpless and dependent, an accident victim, automatically they're scanning for an authority, the one least uncertain. And that's going to be the person who takes control. Now, if you take control, let's say you do, okay, you know some first aid, you take control, you have authority. And authority is one part, and a major part, of the hypnotic method. It automatically endows your words with a hypnotic influence. And so you have to think what you want to happen. If they're bleeding, you say, you don't need to be fancy in any way. You say, I need you to stop your bleeding now. It helps if you're breathing with them, that's rapport. But you're using your authority to tell them. Now, people out there might think, oh, that's silly. You can't just say stop bleeding, and they'll stop bleeding. But as an emergency physician for 20 years, using that very technique, of course, I had tremendous authority. When I told people to stop bleeding, much to my surprise, they would stop bleeding. When I said to someone I was putting a tube in their airway, and I whispered in her ear, because she was about to die of respiratory arrest, and the tube wouldn't go. There was much resistance. And I said, you can let this in like a breath of fresh air. I was as surprised as everyone in the room to feel that tube just suddenly slip in. Hook her up. Life saved. And it's the same with cardiac arrhythmias and so many, many things. So the key thing to remember in that situation is you're the authority. You can direct the outcome. You just have to offer the positive idea, not the negative idea of these frightened bystanders. You can stop your bleeding, seeding the idea, meaning presenting the possibility. And I need you to stop that bleeding now. And don't be opposed to surprising yourself. It will stop.
Thank you. Thank you.
Yeah.
Steve.
Good to see you.
And Thank you for taking the time to answer a few questions.
You're welcome.
Bye bye, everyone.